Good day, everyone. This is CJ Asena from the Shangri-La Plaza, and welcome back. This is the 49th episode of the PRA Virtual Learning Series and our last webinar for 2021. Now, I'd like to have do a special shout out to our viewers who are in, aside from the NCR, Tugigaraw, Laguna, Batangas, Pangasinan, Legazpi City, Naga, in the Visayas, our friends from Cebu, Iloilo, Dumaguete City, and from Mindanao, Zamboanga, and General Santos. Welcome to this webinar. Now, it's going to be a very exciting one. We had a meeting with our technical run with our distinguished guest today, and it is you can ask your questions. Don't be shy, just give us your questions because it's a very relevant insight. It's a very relevant topic, a hot one if you ask me. Now, retailers and mall developers have invested heavily in adapting their business to changing consumer behavior today. The pandemic evolved shopper, okay? And the realities of doing business in this post-pandemic period is difficult, it's challenging. We have to pivot, okay? It is such a Darwinian experience for all of us. And this pandemic continues up today with Omicron coming in. So it's far from over. It's not just an endemic, but it's time to prepare for a better holiday season and hopefully recover in 2020. So we asked a health expert to join us today to tell us, how do you lead your organization with resilience and empowerment? And what should we do next to protect our people, our shoppers, our business, and our communities? Okay, but before we get into this exciting and insightful conversation today, let me call first our PRA Vice President and Mercury Drug Corporation President and General Manager, Vivian K. Ascona. Hi, Vivian. Merry Christmas.
Hi, CJ. Merry Christmas.
Nice to see you again. It's been a while.
Good to see you too. Yeah.
Okay.
Anyway, magandang hapon po sa inyong lahat. Welcome to PRA's 49th Virtual Learning Series webinar. Thank you for joining us today. We in the PRA are always delighted to present to your members and all our fellow retailers another informative and relevant VLS episode that aims to equip you with the right knowledge and tools, especially now as our industry is finally opening up and heading its way towards recovery. In today's episode, we are very fortunate to have with us Dr. Tony Leachon, a renowned expert and a health reform advocate, who will guide and enlighten us on how to end the pandemic through a resilient and empowered retail industry. In his session, we shall know more on how to build pandemic resilience through education, science, technology, and innovation. We hope that his webinar will help us retailers and all business owners gain more knowledge to help properly safeguard our employees and our customers as we reopen our stores and businesses during this holiday season. Once again, thank you very much for joining us this afternoon, and may we all have a productive webinar. Keep safe and healthy, everyone.
Thank you, Vivian. Tuloy ang Pasko, right, Vivian?
Of course.
Okay. I'd like to acknowledge also our PRA Vice Chairman, Enchong Formoso. He's joining us today also. Hi, Enchong. Nice to see you also. All right. Thank you, Vivian. Thank you, Enchong. Let's get this show on the road. Oh, by the way, if you have friends or colleagues who want to join us today, you may still invite them to register and catch up with our conversation this afternoon. This episode is live on Zoom, but they can also see it in the Philippine Retailers Association official Facebook page. All right. I'm very excited for today. In fact, I have questions already, and I've talked to some people who'll be asking very interesting questions too. So let's introduce our expert. He's a multi-awarded Filipino physician leader on preventive health education and health reform advocate. He was one of the outstanding Filipino physicians in 2008 and the outstanding Filipino in medicine in 2010. A graduate of the University of Santo Tomas Faculty Medicine and Surgery class and a leading internist at the Manila Doctors Hospital. He also served as president of the Philippine College of Physicians and the UST Medical Alumni Association. At the start of the pandemic, in March 2020, he was designated by the Philippine government as special advisor to the National Task Force on COVID-19. Today is the chairman of Kilusang Kontra COVID or KILCOVID. And did I tell you, he used to be a corporate person too. He used to work with Unilever and Pfizer's medical director. Ladies and gentlemen, please welcome health reform advocate and I'd like to say truth teller, Dr. Tony Leachon. Dr. Tony, good afternoon. You're on, Dr. Tony.
Yeah, okay.
Here we go.
Okay. Okay, can you hear me and can you see me?
Yes, we can see it.
Okay. Maraming salamat CJ and for your gracious introduction. I'd like to thank Vivian, Skona, and of course my good friend Enchong Formoso, and also the retail industry. I was once a part of the corporate world, so I know how it is, and I'm really a supporter of the business sector. And I'd like to add value, particularly sa inyong lahat po. Since this is also being streamed live sa Facebook, so I'd like to express some of the I would say statements as well as data, medyo taglis tayo so that we can understand the whole situation. And I promise that I'd like to bring you from the start of the pandemic up to the present time and asking the right questions. Where are we right now? Nasaan ba tayo? Pangalawang tanong, saan natin gustong pumunta? Where do we want to go? At ang panghuli, how do we get there? So I'd like to start off with this particular flow of the agenda. So I'd like to give you a snapshot ng global at saka Philippine data. And then try to discuss yung Bloomberg resilience rankings. Ba't tayo nag-fail? What went wrong and what went right? Anong latest ngayon sa Nikkei Recovery Index? No? Kasi working in the corporate world, at alam niyo naman po yun, we cannot manage what we don't measure. So meron ho tayong metric of success, meron tayong key performance indicators, at kailangan natin po yun. At gusto natin pag-usapan yung different variants, particularly itong global threat right now. Ang pangalan ng variant is Omicron. And what would be the far-reaching implications pagka nakapasok siya sa bansa natin. Now, let's discuss vaccines. And I'd like to, of course, tell you that I used to work with Pfizer. I used to work there as medical director from Warner Lambert. And then some mergers of Pfizer and Wyatt. So I had a stint in New York and other areas. Kaya I'd like to bring to the table yung experience ko on how to launch products po. Then boosters, and then the herd immunity. And ano ba silver linings natin? I think leadership and health medyo magkasama siya. And I think finding the right leaders sa May 2022 elections will be also important in trying to navigate not only the business but the health of the country. All right. Now this particular slide ay medyo importante po siya because lahat ng slides natin on the graph nakalagay ho dito. And I presented this siguro mga 4 days when I was assigned as the National Task Advisor sa IATF. This slide is, ang tawag dito is the hammer and dance concept. Done by Tomas Pueyo, a Stanford University professor, Spaniard. And basically, ang concept is basically here on the y-axis or vertical axis. Ito yung number of cases natin. Alright, kung maraming cases and we do nothing, steep yung curve. Right, so itong tawag na to na parang Mayon volcano or Mount Everest is actually the epidemic curve. Now, if we do mitigation measures, ibig sabihin testing, tracing, all isolation quarantine measures and trying to learn, understand the true cases, recruit personnel during the time. If you remember, aayusin natin yun. So, while naka-lockdown tayo, if you remember, March 15 nag-ECQ, and we were at the Camp Aguinaldo at that time, dapat at that time, gagawin natin ang lahat. Pero dapat, ang pag-lockdown, hindi dapat sosobra ng 2 buwan. Kaya ang China during that time, mainland China, naisara niya ang COVID in 3 months' time with a number of cases na 80,000 cases and 4,000 deaths. Kasi kung masyado mahaba ang lockdown, magkakaroon tayo ng economic depression kasi wala makakapagtrabaho. Now, pagka okay na yung cases natin by doing the testing, tracing, isolation, quarantine, and then later on vaccine, then we can open the economy. And the term used by Tomas Pueyo is actually the done segment. But during the done segment, ang quarantine restrictions natin bumababa, we should keep the reproduction number less than 1. All right? Ang testings pa rin natin gagawin, all these here capacities, we should have a massive public awareness campaign. Like today, ginagawa natin. And then a large gatherings, ina-avoid pa rin natin. Meron pa rin tayong mga restrictions. Nagpa-follow pa rin tayo. So basically, this is the hammer and dance concept. Now, globally, this is very new, ang COVID-19 is continues to spread around the world with 265 million confirmed cases and more than 5 billion deaths. Napakarami. Ang Singapore is about 6 million. So imagine mo kung 6 million, kung paano mo siya ipipicture, di ba? Ang NCR is about 12 million. So kalahati, pipicture mo siya. So 5.2 million deaths, 266 million cases. Ang US, India, and Brazil have seen the highest number of confirmed cases, followed by the UK, Russia, and Turkey. Now, this is the US. Bakit US ang ginawa ko na example? Kasi for a time, siya yung number 1. So right now, ang US, despite 60% na vaccinated sa kanila, they're still right now with 100,000 cases because of some problems in vaccination, execution, and of course, because of the Delta variant. A number of deaths sila a day ay nasa hovering sa mga 2,000 cases. Now, this one is a nice slide kasi gusto ko pakita sa inyo na may surge kayo sa Europe. And this is from the Johns Hopkins University. And talagang hinanap kong slide so that you will understand how the other countries are behaving. Now, papapansin nyo, may winter surge ang tawag yan. Kasi pag malamig ang panahon, there's increased transmission of the virus. And some of the countries na nag-lockdown na, despite mga G7 countries, look at Germany, nagkaroon sila ng surge. And then UK, napakalaking bansa na naglabas ng Astra and still meron silang surge. Ang France, kahit mandatory ang vaccination by Emmanuel Macron, look at this. And then Russia. You have Poland, you have Netherlands, you have Belgium. Sa Bloomberg's resilience ranking for October, September, they top the charts. And suddenly, here you are, meron silang surge. Reason for the surge are the following. You have right now very cold temperature. Ang cold temperature importante kasi it facilitates transmission. Number 2, kulang sa ibang countries sila ang vaccination, particularly those countries na nasa Eastern Europe, mga na Ukraine, Slovakia, yan ang mga countries na kukonti pa, and you need a booster for that. So that's Europe. Para ma-explain ko sa inyo in a nutshell, sila ngayon ang epicenter sa buong mundo. And 50% of the infections galing ngayon sa Europa. Alright, now let's go to Latin America. Latin America, dati ang Brazil ang daming namamatay. Look at the data, no? Very fresh. I'd just like to tell you, no? From the inception of the first hanggang ngayon. So you have different curves, but Brazil, dati 3,000 na namamatay. Mexico, ganun din. Colombia. And look at Chile. Ang taas ng vaccination rate niyan. Ang problem lang din sa lang Trinidad and Tobago. Now, anong difference? The temperature again, hindi masyado malamig sa Brazil, and then nakapag-vaccination din sila. And Chile is one of the most important proponents of vaccination. Almost 90% sila. All right. Now, let's now go to the Middle East. Middle East countries, with the exception of Jordan, magandang performance sila, particularly Israel. So you can see, nasa downward trend sila. So you can only pinpoint dalawang countries like Jordan and Egypt na mayroong problema. But the rest, okay sila because they are a disciplined country. In fact, ang Bahrain ngayon, number 1 sila sa Nikkei. At ang UAE, number 1 sila ngayon sa Bloomberg Resilience Ranking. I will explain yung parameters na yan. And actually, it's anchored on a good vaccination and good leadership as well as governance para maintindihan natin lahat. Now, this is Israel. Israel is my model country. Sila yung first in the world to ditch the face mask. And sila din very innovative. And also, they are the country na nagbe-benchmark ang Philippines. In fact, inimbitahan natin ng Israel para makita natin ang best practices nila. And at the start, nagkaroon din sila ng mga surges because this one is secondary to the Delta variant. And then, nagkaroon sila, you remember na nagbakuna sila January, and then napababa nila yung curve. And this was the time, March 2021, nag-celebrate sila, wala na silang mask. But the Delta variant, pumasok sila from India. Ang ginawa nila, nag-booster, mamaya I'll tell you a story about it. Sa kanila nag-umpisa yan. And then binakunahan nila almost 10 million ng kanilang population. So new cases sila ngayon 804. And look at Israel. Sila rin ang unang country mag-ban after the Omicron declaration. Walang papasok sa amin, sa aming bansa. Ganon sila kadisiplina. Alright. Now, let's go to Asia. Ang Asia dati, whipping boys before. At ang dati nagtatap, Vietnam, because of their discipline sa border control. And if you remember, South Korea, nasa top 3 yan lagi. And yet, meron sila mga surges, no? Right? Because they open the business and sometimes nagkakaroon ka ng surges. But yung dating may cases ng Delta variant. Remember India at one time, last July, 400,000 cases and 4,000 deaths. You remember Thailand na nagsuffer? Look at this. And then Malaysia, dati. Right? And then if you remember Indonesia, na 50,000 ang cases dati, look at this. So, and then the Philippines right now, okay tayo ngayon at 400. And the rest, okay tayo sa Asia. Anong characteristics natin? Medyo hindi malamig sa Asia. That's number 1. Number 2, nakahabol tayo sa pagbabakuna. And nakapag-testings tayo, tracings and everything. So, the Asia is actually in a position right now to open the business, particularly sa holiday season. So, napakaganda, no, to compare ng mga countries ang kanilang performance, no. Now, this one is actually South Africa na nandyan ngayon ang Omicron, no, na-explain ko sa inyo. Look at South Africa, nakailang wave sila, nasa 4th wave sila, and masyadong steep ang curve nila. Makita mo rin ang Egypt, makita mo rin countries. Kawawa ang actually ang South Africa because of the lack of vaccination. Ito 25% lang. But makita mo other countries, particularly Nigeria, nasa single digit lang ang kanilang vaccination rate. Now, punta tayo sa Philippines. This is the 4 o'clock habit natin lahat na nilalabas ng Department of Health. This is what we call the multicolored Department of Health bulletin. Turuan ko lang po kayo ng konti para maintindihan natin. We look at the number of cases, 370 cases yesterday. So below 1,000, that's good. Ang total na natin is 2.8 million. Ang sinabi ko, kailangan matigil na natin kasi ang daming cases dyan. Dapat parang tayong China na 80,000. The number of deaths natin, madami pa rin. Dapat talaga walang namamatay. Ang total na natin, 50,000 deaths. Now, ang maganda sa atin, yung positivity rate natin, which is the number of positive tests over the number of tests na ginagawa natin. And the benchmark used by the World Health Organization is actually less than 5%. Ang testings natin should be dapat nasa 100,000. Surveillance pa rin tayo. So that nakikita natin. Lalo na unseen yung enemy, hindi natin nakikita. So kailangan talaga nagte-testings tayo. Magandang hospitalization natin nationally and the NCR. Pag sinabi nating high risk, yan ay dapat mga 70%. But we're right at 24% both local and national. Now, sa buong taon, ito ang buong this I got from Edson Guido. So nung una, meron dalawang tayong cases, if you remember, nag-umpisa yan. And then nag-lockdown tayo March 15. And then we reopened, if you remember, in August. Dito tumawag ng time out ang mga doktor, 6,000. And then the president granted an MECQ. And even during the holiday season, last year, na-manage natin na 2,000 ang cases natin. O, kita nyo, medyo flat siya. Ngayon, less than 1,000 tayo. So we're in a better position right now. Kaya lang, wala pa tayong bakuna. Diyan lumabas ang bakuna. Now, hindi natin na-anticipate variants, UK, South Africa. So, nung March, tumaas siya. And the peak was 15,000. And then, nagkaroon tayo ng restrictions, bababa. Ang problema, 5,000 pa lang, pinuksan na natin kagad ang economy natin. Tapos dumating ang Delta variant. In August, 26,000 yan. And then gumanda tayo up to the present time na less than 1,000. So that is the review in 1 year. Now, so the Philippines, ang total natin ay 2.8, 50,000 deaths. So in summary, ladies and gentlemen, ang Pilipinas po ngayon, ito kahapon lang, December 8, Immaculate Conception, today December 9. Meron po tayong 2.8 million confirmed cases at 50,000 deaths. Sana matigil po yan kasi this could be a relative, a friend, or a workplace. So kailangan natin humagawa. And ang susi niyan ay ang pagbabakuna. So tayo lahat po ay dapat po magpabakuna. But I'd like to discuss not on doses, but on the percentage of immunity. Now, in fairness to the government, meron naman pong plano. And maaaring hindi lang properly articulated, depende po sa communication strategy ng government. Right. Ang nagkulang po tayo talaga po sa testings po at sa contact tracings na natutugunan na po ngayon. So for a long time, yan ho ang problema natin. So, ladies and gentlemen, kung gusto natin pong ma-end ang pandemic, it should be in our cycle na or in our life, as a way of life, na dapat magte-testing tayo. Mabuti na lang, meron ng rapid antigen test, meron tayo RT-PCR kasi masyadong prohibitive. At dapat tayo magkakaroon talaga ng contact tracing at napakaganda niyan. At marunong din tayo mag-isolate, marunong din tayo mag-quarantine. At ito dapat, every Filipino should be empowered about testing, tracing, isolation, and quarantine. Now, pagpaumanhin nyo lang po ang cartoon na to, kasi ang nangyari po sa atin dati, pagka po tayo meron surge ng cases to at hindi tayo handa sa testing and tracing. Ang nangyayari po, nagla-lockdown tayo to protect the people na walang mamamatay. Ang problema, pag konting baba lang po ng cases at hindi pa ready, ang nangyayari po, we reopen right away the economy. Mapapansin nyo ngayon, the secret natin ngayon, kahit mababa na ang cases, hindi pa natin ina-alert level 1. Kasi hindi pa completely vaccinated. Ako isa sa proponent na wag na muna. Kasi pag bukas natin at holiday season at maraming tao at hindi pa bakunado ang lahat, then we will have a problem. Magse-search na naman tayo. And then we will lose the gains of the last 6 months natin. Sayang naman. And we are right now at the cusp of success. Hindi tayo pwede mag-fail. We cannot endure another failure this time. And we should be careful right now. Relentless tayo in terms of opening the economy, But at the same time, we should actually put the safeguards also. At yan sa karanasan ng isang doktor na nagtatrabaho sa ospital. Sometimes, kailangan natin na gumamit ng ganong klase mga preventive measures. Now, this is the Okta, my good friends from Okta. Nakikita nyo lahat green na, low risk na talaga ang NCR at saka ang buong national. Kaya alert level 2 tayo. But ako as a physician, I don't want to declare victory too soon kasi meron pa tayong things to do. At malalaman natin yung things to do, right? Okay. Now, this one is last year, same period last year, at ito same period last year. And all the metrics will tell us, comparing the NCR the past week, the same period last year, ang case natin lower na, ang reproduction number natin lower na kaysa sa last year, di ba? The average of number of tests maaring the same, but we are good right now. Ang ating hospital beds, okay na. So the numbers would show that we are improving, right? Kaya lang ako, feeling ko, let us not be overexcited at baka na naman hindi tayo ready, magkaroon tayo ng problema. Now, one thing din, wala na rin masyadong cases. Makati Medical Center 2 days ago, my good friend, the medical director of Makati Med, for the first time since 20 months, nag-post sila ng zero census the admission. Ganun din ang hospital ng Maynila and some other hospitals. Sa aming hospital, halos wala na rin. So, we're good right now. And this is an opportunity to open the hospital to see naman non-COVID cases. Now, let's look at kung bakit tayo nag-fail. Alam mo, maganda yan eh. People na hindi titingnan ng historical figures, then we will try to repeat it. So, itong November, ang Pilipinas ay nasa dulo ng Bloomberg Resilience. Ito'y ginawa November 2020 and every year nagbabago. Pero at the time kasi, hindi pa natin masyado na-improve ang ating vaccination rate during the time ng November. Kaya we were at the cellar. So let me explain. No? So ito yung top 10 last. This one is last October nung tayo ay pumalya. Kung mapapansin nyo, this is UAE na pala. Ito na yung bago kasi Ireland yung una. Look at UAE, no? Look at their vaccination rate. Ito yung doses, no? Dito tayo nagkulang sa vaccination rate, ang lockdown severity natin, and then ang flight capacity. Siyempre, pagka mataas ang cases at hindi bakunado, kukunti ang nagbibiyahe, and even the vaccinated travel routes. So, ang main problem natin ay the vaccination. At dito tayo makikita mo, per vaccine doses per 100, makikita mo, mababa tayo rito. So, yun ang scorecard. Now, hindi naman siya cast in stone kasi dati ang number 1 Ireland, bumaba sila. Ang UAE, galing sila sa baba, umakyat din sila. Even US and UK, tumaas sila coming from number 29. No? And this is the Philippines. So, I think in December, we will actually, perhaps in the 20s, hindi tayo yung huli. No? Now, ano yung methodology? So, this was October. So, we were at the cellar and the bottom October, September and October. Ito yung methodology para maintindihan natin. Yung overall mortality. Ang global leader score ito. So, we failed actually in the following. Alright? Vaccination coverage. Yan. Universal healthcare natin, hindi na natin implement. Human development natin, umaalis sa mga doktor natin. Yung positivity rate natin napakataas. At the time, second tayo sa Mexico sa worst. So, yan ang mga dapat natin ginawa. Mobility natin dahil naka-lockdown tayo. Ang flight capacity, problema rin tayo, the lockdown. So, dapat yan, meron tayo niyan metric of success at doon tayo dapat inayos dito. Now, look at the silver lining. Sa DK naman, nag-jump tayo from 103 to 57, 46 points ang tinaas natin. So, because at the time, gumaganda na yung vaccination natin. So napansin nyo, Bahrain, Kuwait, UAE, Middle East ang number 1 instead na dati puro European countries na. So we're good. And I think by December, we will perform pa sa Nikkei natin and actually sa Bloomberg Resilience Ranking. So if we're number 55 right now, siguro kung maka top 10 tayo, siguro yun ang chance na makapag-open ng business natin. Alright, so after that, let's discuss the strain. Okay? The original Wuhan strain was discovered December 9 of 2019. Then nagkaroon tayo ng mga variants. This one caused the August surge. And then UK, South Africa, Brazil, Philippines, India, Lambda. At ang Delta variant, ang pinakagrabing naging variant na nakapasok sa buong mundo. Halos buong mga 140 countries. Highly transmissible, 60 to 100, 1,000 times ang viral load. Dati, 15 minutes kung mahawa ka, then naging seconds. And spreads faster in poorly ventilated areas. So we must prepare our ventilation. At mas grabe siya kung hindi ka bakunado. Now, let's talk about the Omicron. Again, I'm using new data, December 7. So the new COVID variant has continued all over the world. And it has been recognized as a variant of concern November 24. Pag sinabi natin variant of concern, ang characteristics yan ay rapidly transmissible, maaring ang bakuna hindi magiging effective, maaring ma-severe siya, at maaring magkaroon ka ng COVID infection. Right? At ang sabi ng iba, mild lang naman to. So tingnan natin. So naka-spread siya in South Africa, meron ka sa Hong Kong, meron ka sa Great Britain, at nakakalat siya sa 57 countries na. Ito December 2, but last night, 57 countries na siya. Right? At wala pang final decision kung ang symptoms niya ay mas severe kaysa sa Delta variant. Yan. At malalaman natin yan sa Friday or Saturday. Because when it was declared as a variant of concern, last November 26, sabi ng WHO, we will find out on November 20, on December 9 or 10, whether this is actually rapidly transmissible at the same time kung siya ay ferocious or more virulent. No? Now, ang question natin, paano nangyayari yan? Yung high number of cases kasi ng mutations, nag-uumpisa yan kung hindi masyadong bakunado ang isang country. And pag sinabi mutation yan, nagkakaroon ka ng changes sa genetic code. So let me go to the Africa. Tingnan nyo ang vaccination rate ng Africa, nakakaawa po. 1.79 Nigeria, 1.29. Ang mataas lang dito ay yung South Africa na ang capital ay Cape Town. So ibig sabihin, 1 in every 4 lang ang bakunado sa kanila. Botswana, isa. But look at the other countries. Kaya nagsuffer ang South Africa. Now, paano nakakapasok yan? Now, this one is parang bola yan, parang coronavirus. At ang spike protein would help enter the human body. Ganito po yan. Yan yung tusok-tusok na yan, papasok yan sa cell. At nagkaroon ho yan ng mutation o pagbabago ng anyo doon sa spike protein. At delikado yan kasi baka hindi makilala na ng immune system natin yan naturally and even also the vaccine. Now, ganito po ang pangyayari. Let me explain that. Like all viruses, ang COVID, pabalik-balik siya. SARS-CoV, MERS-CoV. Yan. Now, nagkakaroon ka ng mutations in the genetic code. At ang spike protein, ito po yung part of the virus that enters the cell. Right? Okay? So, klaro po yun. Yan ang dumidikit. Ngayon, ang nangyari, ito yung variant of concern, 5 ho siya. 32 ang mutations doon sa spike protein. So, that will actually evade ang immunity natin. Magkakaproblema tayo. So, kailangan natin to i-consider. Kaya hinihintay natin the World Health Organization statement because sabi niya, this is a global risk since hindi pa tayo nakakawala dito sa Delta variant. And that's the reason why naging conservative tayo in terms of loosening up our quarantine restrictions because of the threat of the Omicron. Now, ang pinangalan po ang mga variant sa Greek alphabet kasi po ayaw natin ma-ostracize yung mga country. So you have alpha, beta, and Omicron is the 15th letter of the Greek alphabet, no? Kung makikita natin. Right. Now, anong initial studies po natin? Ang initial study ay makita nyo, medyo steep ang curve kahit bago pa at pababa na yung delta. So kahit bago pa siya, medyo mabigat po ang nangyayari. At ang reinfection ay 3 times more likely with the Omicron according to the research. Now, ito ang magandang slide for everyone. No? And I got this from one particular publication. Ang classical nating COVID ay mag-uumpisa sa lagnat. Tapos magkakaroon ka ng sipon. Tapos magkakaroon ka ng walang sense of smell or taste. At magkakaubo ka. Pag nangyari yan, papasok sa baga mo yan. Mahirapan ka huminga. Magkakaroon ka ng severe acute respiratory syndrome at ang iba magtatay. That is the classical COVID. This is the classical Delta. Walang Omicron will present as fever and headache para may flu, pero para kang pagod at may general body pains at may cough ka. So, ang lumalabas based on paper, hindi siya parang mas delikado, pero highly transmissible. That's why wala tayong masyado narinig na namamatay kumpara nun sa India. Pero hindi pa final yan, and we hope na ganitong magiging itsura niya. Right. Now, sabi sa akin ni CJ, Doktor, alam niyo po ba, marami itong namamatay na because of their cardiovascular risk. At gusto ko i-explain yan kasi magpapasko, alam niyo naman kung magpapasko, marami po nagkaka-stroke and heart attack. At sino ang ina-atake ng COVID? Now, si Boris Johnson at si Donald Trump ay pareho po matataba po siya. At ang nangyari po, naapektuhan ho sila. At alam niyo po ba, when you're obese, at a greater risk of hospitalization at hospital. Kaya ayaw natin tumaba po tayo. At ang mechanism niyan ay ganito po. Pagka po kayo mataba po, madali po kayong magkaroon ng hypertension, diabetes, cholesterol. Kaya dapat nagpapacheck up. At pag nangyari yan, mahihirapan ho ang inyong pulmon na makahinga kayo at this results so in problems. Right? Yan ang connection. Ngayon, last year, September 27, sabi, ang dami namamatay. So nagulat tayo, hindi pala ang COVID ang top killer last year. At 6 other diseases ang pumatay sa Pilipino more than the COVID. Kaya lang, pagka nagka-COVID ka at high risk ka, magkakaproblema. That's why nung in-interview po ako, sabi ko may double pandemic tayo last March. Anong ibig sabihin yan? Ang ibig sabihin yan, meron tayong diseases na primary cause of death and being pushed pagka nagka-COVID ka. Kasi nawalad ka ng clinic check-up, the lack of attendance of doctors, they cannot go to work. Yan ang nangyari niyan. Nagkaroon ka ng mga cardiovascular disorders. No? Now, ito yung mga sakit based on the Philippine Statistics Authority. Na ang COVID, ito, imagine niyo yung COVID. Pero ang dami ngayon may sakit sa puso na hindi. Kaya nung nagkaroon ng COVID hospitals, na-displace yung mga pasyente. At napaka-importante niyan. At alam ni Vivian yan, kasi alam naman natin, 25 billion ng hypertensive, ang diabetic ay 10 million. Saan pupunta yung mga yan? Yung mga cancer patients sa magpapakibo. Kaya ang dami na i-stroke din. Yung mga diabetes hindi na control, kawawa naman po sila. So we have to look at this particular angle as well. Lalo na ngayon na gumaganda na yung COVID. Ang mga bata rin dahil unvaccinated. At ang maraming bata rin because of the COVID ay hindi na rin po nakapag-diet. At alam naman natin ngayon sa pag-aaral sa England, pag mas mataba ka, mas madali ka ma-hospital because of the other comorbid condition. At dahil tayo in the panahon ng COVID, lagi tayo nakaupo. And pagka 8 oras ka nakaupo, tataba ka and you will have other problems. Kaya this is the checklist manifesto by Atul Gawande, one of the advisors po ni President Joe Biden. And in my clinic, meron dalawa akong reseta. You have to take the medications regularly. Pero you have to stop smoking, magda-diet po kayo, mag-exercise kayo, yung body weight yung ayusin nyo, huwag po tayo masyadong uminom ng alak, stress. Kaya tayo maraming ininom na gamot dahil hindi natin siya piniprevent. Alright. So the reason why we fail is ignorance. We have to educate people. The second reason, ineptitude, pasaway. Alam nilang masama, manigarilyo, alam nilang to, pero sila po ay pasaway. Then ang pangatlo, wala tayong blueprint for change on how to educate the people. Now, ito ang diet. Pagka nagpasko, sabihin ko, sinama ko na po ito kasi ni-request ni CJ. No? Ito po, ang plate from the Harvard Medical Schools. Tingnan nyo, marami dapat gulay, prutas, at wag marami masyadong kanin, at wala tayong masyadong processed food. Simple lang po. At wala masyado tayo mga soda at caffeine masyado. Alright. Now, this one is a beautiful slide na alam naman natin ang face mask, social distancing ay nakakatulong. Personal responsibility natin. Pero the one that will save us to end the pandemic, aside from the government's effort, ay actually ang vaccine. So yesterday, a celebration. The first woman na nabakunahan sa buong mundo ay Margaret Keenan, a 91-year-old grandmother, at ang nag-inject ay isang Filipino nurse by the name of May Parsons. At itong bakuna will make the antibodies. So yesterday ang celebration, di ba natin, December 8, Immaculate Conception. So this was yesterday, eto siya. And she was the first woman. At ang sabi niya, the best Christmas gift is actually a vaccination para sa bawat Pilipino at sa buong mundo. Now, lahat ng bakuna ko, I'll tell you, effective siya in protection sa severe disease at sa hospitalization. Lahat ng bakuna mga kailangan ng 2 doses except for Johnson & Johnson. So, dapat magpabakuna tayo para sa ganon, hindi tayo ma-hospital, hindi magkaroon ng severe disease leading to deaths, no? Alright. Now, ang kinakatakutan nila lagi yung side effects, hindi na kinakatakutan ng COVID. So po, ako'y Astra, and then ang akin pong booster ay Pfizer. Ito lang ho ang nangyari po lang sa akin. May konting pain at the site of injection, pero before, nag-paracetamol ako at nag-anti-allergy. I did not have headache, walang fever, may konting fatigue, yan. Very mild, no? At ang side effects na yan are a sign that the vaccine is working to jumpstart your immune response. Kaya dapat i-educate. Dapat sa inyong workplace, gumawa po tayo ng infographics para ipakita yan visually. Para sa ganun, we educate people eh. Ang laking bagay if people will understand that eh. Ang problema, wala tayo nun. Kaya ang nananaig is fake news. Now, we should be part of the largest and the most complex public health effort in the history of the Philippines. And this will help not only the business sector, but the population in general. Ganito po ang herd immunity. Pag hindi bakunado po, okay, at zero pa, ito ho ang infection. Pag 25%, ito ay infection. Pag 50% people's protection, ang target natin for December 31, ganito po itsura. But look at 75%, no? Ang vaccinated. So, mapoprotect ng vaccinated yung hindi vaccinated. Ngayon, pag kami Delta variant at Omicron, dapat ang vaccination natin ay 90%. Ngayon, less than 40% pa lang tayo nationally. And only NCR is above 90%. Now, paano na-discover ito? My favorite country, Israel. Noong nagkaroon ng Delta variant, July, napansin nila yung mga unvaccinated individuals, ang taas ng death rate. Yung mga 2 shots, kukunti ang namamatay. Pero nung ginawa nilang 3 shots, wala halos namamatay. At in fact, nagre-register sila ng 0. So a fully immunized individual is actually a person with 3 shots. And napansin din nila, ang nadali ay less than 80 years old. In fact, 50% ng mga taga-Israel during that time, ang majority ay less than 18. Kaya nirekomenda nila sa US FDA sa kanila, less than 18 bakunahan na. Doon nagkaroon ng approval for 12 to 17, 5 to 11, at ang booster above 18. Now, ang Israel talaga ay innovative. Trailblazer talaga sila. Sila nag-umpisa niyan July using the Pfizer vaccine. And then sumunod na England and other countries na nagpapatunay na when you add a booster shot, that can actually save us to end the pandemic later on. Ang daming publications to tell us. Now, if the booster shots will be used, baka makatulong yan sa Europe. At yan ang concept na pinupush natin. And Israel right now is in a winter surge. Now look at this slide, very beautiful. At yan bago lang December 7. Tingnan niyo po mataas ang cases po sa Europe. Ang US nagkakaproblema sila because of the anti-vaxxers. Pero ang Canada, ang galing nila mag-manage eh. So mababa ang kanilang cases. And even, no, yung again, napakita sa number of deaths din. Makikita mo, maayos ang Canada, ang United States ngayon, may upsurge ngayon, at pati ang Europe. So, again, vaccination is key to end the pandemic. Now, makikita rin natin yan, yung response again ng Canada pagka maganda. And of course, that is Justin Trudeau, no? Hindi natin matatawaran. Ang Europe, medyo mahirap i-manage kasi 27 countries, 27 leaders. Ang Canada, 1 leader lang siya. So again, it's leadership and governance. Now, these are the indications according to the CDC, the policy-making body in the US. So 65 and older, hospital setting, above 18. Kaya tayo ngayon, pag nakadalawang doses ka na or nakapag Johnson & Johnson ka, above 18, kailangan kang magpa-booster shots. Now, ito yung schedule natin and I'm sure memoryado na niyan. Pag naka 6 months ka na, pwede kang same brand or heterologous. At yan ay makikita nyo sa website lahat. So lahat tayo dapat magpabakuna. Nag-start yan December 3. Now, lahat tayo dapat kung December 3 above 18, you go to the vaccination center ASAP. At makita natin yung efforts ng Pilipinas tumaas, no? Kaya lang sana inagahan natin siya at hindi lang isang malakihan lang para noon pa man ang ating retail industry at ang business ay naging successful. Kaya lang medyo late tayo naka-order sa ibang mga bakuna at may preference din ang bakuna ang ibang mga tao. Pero ang target natin 15 million, naka 10 million tayo from November 29 to December 3. Not bad. So uulitin-uli natin siya December 15 to 17. At ang target natin ay 54 million, kalahati yan ng 110 million natin. At ang President nag-request again for another one. Hopefully, we can get that particular vaccination another 10 million so that mag-increase tayo. Now, I'd like to commend my good friend, no, si Secretary Joey Concepcion. Ito, kung titingnan natin 2 minutes lang, ang National Capital Region lang ang pinakamataas sa bakuna, almost 98%. At ang buong Luzon, Region 1, 44%. Ang ka-target natin, 70%. Region 2, 43%. Cordillera sa Baguio, of course, magaling si Mayor Magalong, 57%. At ang Calabarzon, 48%. Ang kawawa lang sa Luzon ay itong Bicol, 29%. At itong region, itong Palawan. At ang taga Visayas, mababa rin. Particular Region 7, ito na dito ang Cebu. So the farther you are from the NCR, the lesser yung vaccination rate natin. At archipelago setting tayo, nakapasok nun ang Wuhan. If you remember from Taiwan, nakapasok siya sa Cebu, then Dumaguete, and then nag-NCR. So the challenge for our country is actually to have a national vaccination rate of around 70 to 90%. Ayan ay kailangan nating gawin kasi isa lang ang bagbiyahe niyan sa NCR that can actually infect the entire Luzon area. All right. So ang target ng government, this was December 6, tinaas na natin to 90%. All right. Oh, so klaro tayo dyan, that will be our target, no? And this will be a pandemic of the unvaccinated, remember. And there can be breakthrough infections kahit na bakunahan ka na, kaya lang milder, right? Now, ang swerte, meron na tayong molnupiravir na pwede natin gamitin 5 days kung nagkaroon ka ng COVID, lalo na kung unvaccinated ka, right? Pero compassionate use lang siya, designated hospital siya. Now, ang Israel ang model country. Anong ginawa nila sa Omicron? 100,000 PCR tests a day. Magnificent. Positive test nila, retested again sa isang Omicron targeted test. At after that, genome sequencing nila. Ganun dapat tayo adapt natin ang best practices natin. How about Joe Biden? Ang ginawa ni Joe Biden, expand access to boosters above 18 and then less than 18 babakunahan ang mga bata. Kasi paano makakapasok ang mga bata kung hindi sila bakunado? They cannot even enter the mall kasi pwede silang mahawa. At dapat libre ang testing natin. Sasagutin yan. And then, dapat, ako ang sabi ko sana, kung magpo-provide tayo ng murang mask in every area of the mall or sa business in workplace natin, kailangan. And then, of course, border control. Ang pandemic talaga nagbago. Nire-write ang rules ng retail and we must be creative about it. Alam nyo, nung birthday nung aking daughter-in-law last December 1, ito sa SM to, Directors Club, nakapanood kami ng sine, 5,000 pesos for 12 persons. So 500 lang yung ticket. And then, natutuwa ako, very creative eh. So nakapanood kami ng sine. Pinunod namin Eternals. At kami lang ho yung laman ng sine. These are the ideas na we would like para makabalik tayo. Now, ang sabi ni Secretary General, si Carl Kendrick Chua, sana maging endemic siya. Sure, Secretary Carl, kung mababakunahan natin ang ating populasyon. And since may branches kayo nationwide, then ang isa sa gagawin natin is to vaccinate our employees at pati ang mga customers natin. It's just a matter of time, sa sabi ni Secretary Duque at ng mga economists, dadating sa atin ang Omicron. Pero kahit dumating sa atin ang Omicron, ready tayo for all these particular challenges. Nasa alert level 2 tayo and wag muna tayo mag-alert level 1. Kasi mamaya dumating Omicron at hindi tayo bakunado. Okay naman tayo, chill tayo rito. And I think we're doing well in terms of our GDP. So ang suggestion ko yesterday, keep Metro Manila under alert level 2 until the end of December. Let's prepare our countrymen and make that December a period of preparation. Now, ito yung for the rest of you para maging commercialize ang vaccine. Yung EUA kailangan mag-full approval. Na-approve na actually ang Pfizer sa states na full approval. Ang ibig sabihin yan, pwede siyang i-commercialize na at ibenta na yan so that walang logistical bottleneck from the NTF and every institution can actually vaccinate their employees na and they will operate parang express lane. Now, alam niyo sa states, ang strategy nila is through the pharmacies, through the Walgreens eh. Ang dami kong kaklase, ganyan, ginagawa mga doktor. At gano'n ang ginagawa. When can you get the COVID-19 vaccine? Boosters and why they are needed. So pharmacists ang nag-i-inject, hindi lang doktor, medtech, pwede nating gawin yan. Meron tayong mga i-hire, no? Ang daming mga doktor, medtech. Tapos maganda, meron silang mga ganitong klaseng mga commercials. Imagine mo yan. So pagka-inject mo sa mall at saka sa establishment, edi pwede ka na mag-shopping. Diba? Yan ang maganda dyan. O CVS, minobilize nila ang mga drugstore sa Amerika. So I'm winding down to my last 5 slides. So ano scorecard natin according to the WHO? Is the viral transmission controlled? Of course, less than 1,000 na tayo. Is the health system in place? Yes, some, pero yung Visayas and Mindanao hindi pa sa testings and all. Ang outbreak risk ba? Okay na sa health facilities? Yes, Makati Med in some areas. Ang preventive measures ba nagawa na natin in the workplace? Yes. Ang schools, nire-ready pa natin ng mga bata. Border control? Yes. Ingat lang tayo kasi because Christmas may magbabalik pa yan. Pero ito ang kailangan. We need to empower ang retail industry employees at pati ang mga customers. Dapat marami tayong signages. because every Filipino should be educated, engaged, and empowered to adjust to the new normal. Alam nyo, this is the elephant in the room syndrome. Ito tayo, no? Pero ang biggest problem, kailangan ma-recognize natin, the economy will never recover as long as the virus is not controlled, particularly sa Bisbee area, nababa ang vaccination rate. If we don't understand that, then we're part of the problem. So kailangan natin maisip yan. And ang wish list natin for the Duterte administration and even beyond May 2022, dapat maayos ang ventilation ng mga workplaces. Dapat libre ang testing for the workers. Dapat maganda ang inyong app pagpasok pa lang. Mahigpit. There's a network of health facilities from barangay to the tertiary hospitals. You have to hire good clinicians in the clinic of your workplace. Dapat maganda ang case data nyo. Use the IT. Dapat ang messaging natin ay kahali-hali na. Improve safety in the transportation. We should keep the vaccination process agile, mabilis, simple, transparent. And then ayuda kung kailangan din ng mga taong bayan. But you need to shape the environment. At nag-uumpisa yan sa CEO. You have to direct the rider or the president of the country. Follow the bright spots of other country. Yung mga critical moves. And then, ito ang tao. This is the elephant. Point that particular person to that destination. Motivate the elephant. This is from the Hit Brothers, no? Find the feeling. Inspire mo sila. Shrink the problem. Grow your people. But you have to have a blueprint for change. Kung wala tayong roadmap, hindi makakapunta ang elephant kung wala tayong roadmap. So ako right now, ang ginagawa ko is to be part of the civil society. I'm chair of the Kilusang Kontra COVID, helping the Quezon City in trying to address some of the problems. Yan ganun eh. Nation building, kailangan natin yan. Good citizenship, kailangan natin yan. So we have a good leader in Quezon City. Taga dito ako sa Commonwealth. And shared responsibility, dapat yan, and vision. But we need to be ruthless in terms of consistency. I'm reading this book. We need leaders with the right commitment, with the right focus, with the right environment, so everybody will win. And alam mo ang secret natin for after May 2022 is to find the leader. No? This is the 2017, but meron akong libro nito since my Warner Lambert days. At ang importante, based on the survey of 100,000 CEO, kailangan daw ang leader na mapipili natin ay men and women with honesty and integrity, competence, inspiring, and forward-looking or may vision. That is on the book na sinurvey nila. At yan din ang sinurvey nila from 1987 to 2017. At consistent siya, honest, competent, inspiring, and forward-looking. So when you choose a leader for May 2022, don't forget these particular attributes. And then execution. I know leaders kayo, CEO, we need the discipline of getting things done. So lastly, we can make the choice to live a socially responsible citizen or descend into anarchy. Or we can make a choice to follow the rules or break them. Or we can make a choice to be right or wrong. But sabi ni Albus Dumbledore to Harry Potter, now that you have the magical talents after graduating from this school, it is not your abilities that show that what we truly are. It is actually in the implementation of your knowledge to make the great choices in society. Now, this is my apo. I work every day, single day, so that my children's children will have a better future. And I hope this will be the driving force for every one of us. So think about it. The metric by which your life will be judged and make a resolution to live every day is to make a difference in the society so that at the end of the day and in the afterlife, your life will be judged a success. Maraming salamat po for your attention. Maraming salamat po.
Wow. Okay. Very, very insightful. And Doc Tony, thank you so much. Thank you so much for including the double pandemic discussion. I think that's very important. That there is something more than just COVID, very basic and fundamental, cardiovascular. We have to prepare for that too, correct? Kaya comorbidity. Dami kong tanong, Doc Tony. And I don't see yet our, yes, okay. There's a thank you from Enchong. Doc Tony, tuloy ang Pasko.
Tuloy ang Pasko. Alam mo, ang Pasko is in our hearts. Now, we are in the position right now to enjoy the Christmas kasi mababa ng cases at vaccinated tayo. Ang Pilipino naman, simple lang ang needs niyan eh. Makakain together with the family, meron tayong hamon and pansit, makapanood tayo ng sine, at makapag-enjoy. Kaya magandang Filipino spirit eh. So tuloy ang Pasko mga kaibigan. Hindi natin to ititigil. Okay, so we're in a position right now to be successful this year.
Okay, you said guarded. You're guarded on this.
Yan. Tama po yung Okta Research Group. Kaya lang po ako as a doctor, ayoko po ng overpromise. Kasi marami akong pasyente palabas na ng hospital, nadudulas pa and all. It's not over till it's over. Nakita naman natin ng ibang countries, di ba, like US, successful sila, Israel, successful sila, Europe, successful sila. Pero anong nangyari? Dahil mababa ang vaccination rate, tinan nyo, nag-surge po sila. Tayo po mga kaibigan, kahit mababa na ang cases natin, hindi pa po tayo vaccinated na nationally. Ang average pa lang natin, binilang ko po 40% pa lang. At ang Visayas and ang Mindanao po, ay mababa pa rin. Let us treat every LGU, every island, every province as a separate country. Kasi ang Hong Kong, Singapore, iisa lang ang entrance lang yan. Singapore, Changi lang. Pagpasok mo ng Japan, Narita lang ka or Osaka ka lang. Madali i-control ang borders natin. Pero tayo po ay 7,100 islands. Ang dami nating international airports. Porous ang borders natin. At kung pumasok ang isang Omicron through the back door, katulad ng mainland China, tagilid po tayo. So what we're going to do is to increase the vaccination rate in those international airports, Cebu, Davao, kasi baka tayo masingitan doon. Kawawa naman ang business nyo nationwide. Hindi lang naman ang business nyo NCR. Ang business nyo buong bansa. So we must be ruthless. Yung word, ruthless consistency. That is ano.
Pero Doc, that's talking about the LGU. What's within our control as business people? Like ito ang sinabi ng gobyerno, lack of vaccinators, okay? Contributed to the stats that Joey Concepcion showed, which you showed.
Kasi ang kailangan niyan, dati na nire-request, pakiusapan natin si Secretary Galvez, that the business sector should be given the latitude na sila na magbakuna ng workplace nila. At pwede naman yung gawin yan eh. Ang iniisip ko nga, LGU, okay, LGU at saka yung mga business sector. Katulad sa Amerika na, nag-full approval na. So, ang umorder na ng gamot, yung mga business establishments na, sila na rin nagte-testing. So, kung lang ang vaccinators yan, syempre, there's a national, I would say program. Saan ka naman kukuha ng 10 million. Pero kung everyday, shrink the problem, di ba, doon sa Hit Brothers. Paliitin natin ang problema. Ang iniisip ko, kung everyday, meron kayong clinic physician, at meron kayong swilling, meron kayong distributor, meron cold chain facilities, at ang Pfizer Moderna, hindi pwede sa countryside yan. Kailangan natin na intindihin what I'm saying is that we should be able to have a replica of the national task force natin. So if we can vaccinate, let's say every day, tingnan natin ang vaccination rate natin per employee. Kayo po ba ay 90% na? Sa family namin, kami po ay 90% na. Tomorrow yung aming mga kasambahay. So kung paliliitin natin problema, 90% ang bakuna or 100%. School, gawin natin 90% to 100%. Workplace, ganun din. Now, ang lahat ng logistics na yan, being managers po kayo, nasa checklist yan. May bakuna po kayo? May vaccinators po ba kayo? Meron po ba kayong IT system? Ang ventilation niya pa po, okay. So if you have the checklist, then you will have a successful vaccination po.
So we go to the micro level. Of course, ideal yung si Vivian will run all her pharmacies with nagbabakuna sa mga pharmacies.
Oo, kasi sa states kasi kaya successful. Dito kasi sa atin pipilan 3,000 tao bago makatapos 8. So you have to increase the vaccination rates. Vaccination centers. Kunyari mga 5,000. Kung 5,100, ilan yun? 500,000 a day. Think about it. If you have 5,000 sites at 100 a day, that's 500,000. So minsan nagbabakuna tayo ng 10 million. Pero tinan mo, nag-increase lang yung NCR. Dati yung NCR 70. So nung nagdagdagan 97, so nabakunahan pala natin nandun lang sa Luzon area. Pero wala tayo sa Bismin. Kaya dapat ganun ang strategy natin. Dapat may visual mapping tayo of the whole country. Di pa pag mahina ang sales natin, tinatanong natin bakit mahina ang Bismin? Meron bang may manpower ba dyan? Dapat ganun ang thinking process natin. Kasi nagbakuna tayo ng 10 million. Yung pala, nakalaan lang yun dun sa Luzon kasi yun ang madaling abutin. But how can you deploy ang $64 question? Deploy the vaccines and the testing into the countryside. Nas mahirap.
Okay. You're getting a lot of positive comments sa ating chat box. Okay, so people are saying educational, mabuhay ka, very inspiring, very informative. And yes, we'll ask more questions. Okay, Nikkei and the Bloomberg, those were controversial. Even the spokesperson of DOH gave her comments on that. So what else can we do to ensure that we improve our ranking in implementing? Aside from everything you said.
Alam natin, when we work in the corporate world, may key performance indicators tayo.
Okay.
And with due apologies sa the government, sana nag-include sila ng public and private partnership. Part dapat kasi ng IATF, ang business sector, that can actually lend to them the talents. Pero ang gagaling yung marketers, meron kayong customer service, meron kayong distribution analysis. Hindi naman sa pag-aano. Let's say you have 60 million doses of vaccine there. Vaccine first out, in, yun ang huli. So, meron tayong bodegero. Alam naman natin na minsan napapanis or nag-expire ang mga vaccine. Ngayon, kung ang talent na yan ay kinuha ng government, alam mo, magiging okay. Kasi sino naman ang aayaw na retail industry na hindi tumulong. So we will do our best in order to make the program of the government successful. What I'm trying to say, in the book John Carter, if they would just research that in leading change, the number 1 is actually sense of urgency. Number 2 is actually a guiding coalition of members, public and private. And then you have to create a vision and then communicate the vision. Celebrate the small wins, and then institutionalize the process. Nagkulang tayo sa number 1, sense of urgency. Nagkulang tayo sa coalition of public and private sectors. Nagkulang tayo sa vision. Hindi kasi tayo open-ended kaya ang tagal natin protracted. Kaya ang bilis ng other countries Kasi a goal without a timeline is a dream. Kaya tayong lahat, ang tawag natin speed to market. Kung lalabas kaagad natin yun. So kailangan, ganun ang dapat ang thinking process natin. Ang galing din yung mag-messaging. Kasi sanay-sanay kayo, may corporate affairs kayo, may public information campaign kayo. Now, if the private sector knowledge na ilbigay natin sa government, I'm sure 6 months ago, okay na tayo.
So this is like a product launch. Supply chain, all the everyday infrastructure has to be there. Now, questions within our control. I mean, things like, should we close the borders to Hong Kong? Should we stop people from coming in from Hong Kong, from LA, from Sanfo? Lalong papasko na.
Ang analogy niyan kunyari my house tapos ang neighbor ko ay merong COVID. Ang kinlose natin taga-Alabang at saka taga-probinsya. Bago makarating sa atin yung itong neighbor mo may COVID. So the right thing to do, 2 weeks lang naman, we should have closed our borders to Hong Kong kasi positive siya. And we have a lot of overseas contract workers coming from Hong Kong. Isa lang makapasok yan to our international airports. Tapos tayo dyan. Hindi mamasamay ng ating mga kababayan if we close down the borders. Ang Hong Kong nga, ang quarantine nila 21 days.
Correct.
Oh, kaya nga nahuli yung taga South Africa, negative yung RT-PCR when that particular South African boarded. And then nakita yan in the Regent Quarantine Hotel. Nahawa pa yung isang nearby traveler. So what I'm trying to say, these borders, ginawa nga ng Israel, pati Hong Kong, binan eh. Ginawa rin ng Japan, ginawa din ng Morocco. Kaya nga sila best practice. And I don't think Hong Kong will actually magagalit sa atin because these are rules of the game and part of that is border control.
Although the WHO mentioned yesterday in their press con that these are discriminatory border controls. What's your comment on that?
Kasi siyempre politiko ang World Health Organization, Miss Universe sila. Kasi Miss Universe sila. Kasi siyempre they want of course yung other countries mag-open. Pero sabihin ko lang sa iyo, alam mo kunyari may magnanakaw. Bakit pa tayo nagtayo ng malalaking gate at matataas na gate kung papapasukin lang natin ito? It's crazy. 'Di ba? Ginagawa yan na practice na we should have closed our borders kung meron. Temporary lang naman yun eh. After ng 2 weeks at nasabi na ng WHO, ladies and gentlemen, to the whole world, the Omicron is less virulent, transmissible. Okay siya. Then we can adjust right now and then we can relax our borders na. But as long as we don't have the information right now, anong kailangan natin gawin? Ang ganda-ganda na ng cases natin. Dapat maghigpit tayo or we lose the gains right now. Isa lang ang makapasok. Remember, may 8 South African travelers ang hinahanap pa hanggang ngayon at hindi pa mahanap yan. So ako personally, I'll close it. Ngayon, pag sinabi ng World Health Organization na CDC, hindi pala ganun kagrabe, then we can actually maintain our quarantine restrictions na katulad ng dati while we actually protect our population and our business. Isa lang makapasok niyan. Ano ba naman ma-offend mo isang country? Ang buong bansa, ang tagal naghirap.
Correct. Okay. That's medyo macro. Let's talk about micro issues. Okay. From my colleague and my friend, Jane Ferrer. Hello, Doc Tony. Are you in favor of bringing back face shield as one of our COVID protection in case of surge? From Jane from the Shangri-La Plaza.
Alam mo, naisaran na natin yan. Nag-decide na ang IATF pati ang presidente. And when you Google CDC and WHO, even WHO, walang role. So science-based tayo dapat. At saka nakapag-decide na din ang MMDA, nakapag-decide na rin ang IATF and even the president that we should only maintain the face shield sa medical facilities and in an area na hindi natin makontrol ang crowd. Okay, optional. But you know, Omicron kasi ang problema natin eh. Bakit natin papasok ang face shield? Ang layo siya sa solution eh. And it is a symbol of public discontent with the Parmali controversy. Now, if we will allow this to open, then mawawala na naman, may erode ang trust ng government. Since the face shield is a symbol of alleged corruption because of the Parmali. And we should not open again that kind of communication because sayang yung gains na nakuha natin. Ngayon, may trust ang mga tao sa government because we're doing so well for this one. So let us not destroy that particular trust na meron tayo. And science-based, hindi rin siya, I would say, nababalidate. So let us not do that.
Okay, before I go into another question, since we're talking about science-based, okay, comments, pausok.
Alam mo yan, nauusok kasi yung mga pausok because we overprotect. But when you read lahat yan, maaaring walang ebidensya. Sabihin ko sa inyo, patawad niyo po ako. Dati yung plexiglass at saka mga barriers sa mga school, ginagamit natin. Nung binasa ko ngayon ng mga international literature, particular Canada, the plexiglass and the barriers pala can get actually the virus at pag di mo nililinis. And it also impedes ang ventilation kasi hindi makaikot eh. So yesterday, nag-declare ang Department of Health at DepEd, tatanggalin na ang plexiglass and barriers. Okay. Then dati ang hydroxychloroquine ginagamit. Then after that, napatunayang hindi. Ang plasma, yung puting dugo, na may antibodies from a previous COVID infection, pag binigay mo, magkaka-antibody, pinatunayan, hindi na pala effective. So what we're saying right now, ang suggestion ko lang, pag nag-implement po kayo niyan, pumunta lang po kayo sa Center for Disease Control sa US at saka WHO. Pag hindi niyo po nakita yung mga ini-implement nyo in the workplace, huwag niyo pong gagawin. It's a waste of money and actually, it may actually be deleterious to the health of your customers. So ang website lang napapasukan nyo, mga kaibigan, Center for Disease Control in America, okay? The World Health Organization, Harvard Medical School, Stanford University, okay? Pag doon, siguradong inaral po nila yun ng mabuti. Pag hindi po doon yan nakuha, wag niyo pong gagamitin po yun.
Okay, doon lang tayo mga kaibigan sa tatlong websites na yun. And I hope Jeffrey, I hope Doc has answered your question on plastic barriers. Okay, so ionizers, Doc, the one that they sell, the upright, and the one that you wear on your, I've seen some of our shoppers wear the pendant-looking thing that's small.
Wala rin. I used to wear that particular, yung parang pendant.
Yes.
Ni-research ko, walang science po eh.
Okay.
Oo. So, marketing po siya. Again, I went to the CDC. Wala po eh. So, dati nagwe-wear ako niyan. Muntik na nga ako masakal niyan eh. Kasi minsan, I was traveling. Napasabit ako sa pinto. So, akala ko
hazard.
Hazard pa pala. Hindi, kasi nagdadangle siya eh. Di ba? Mamaya masakal po kayo. Mahirap naman po yun. Tapos, tinaral ko, ito ba useful? Pagkakita ko, hindi naman pala useful. So, why will I use that, no?
Okay.
Aksaya lang po.
Mahal din siya, no? That's quite expensive.
Oo, mahal din siya. Mahal din siya. Kasi parang 1,500 to 2,000 pesos din, di ba?
Okay. Information sources from Trixie Valdez. With the proliferation of fake news, magiging zombie, pag nagbakuna, etc., what is the best way to convince the masses that the best way to end the pandemic is through vaccination? You talked about
it. Alam nyo, ang dapat ginawa ng government. Sayang, sorry po
Go, truth teller.
Ang kailangan natin dyan is structured education. So, ang ginawa ko nung ako'y advocate, you have to insert into the curriculum sa elementary, sa high school, sa college, sa workplace, ang mga ganitong webinar lectures. Ang dami naman yan, mga CDC. Then ituturo mo. Kung empowered, educated ang mga tao, imagine mo pagka estudyante, nanonood din yung parents nila, magiging okay. Sa atin naman, pwede natin gamitin sana ang PCOO. Alam mo, our country is the only country. During the time, my good friend si Boy Abunda, no? Tayo lang yung country na everyday meron hong chismis portion 10 to 11. So, ibig sabihin, sana meron tayong time allotted for information dissemination nationwide. Yung, kunyari, yung technical advisors ng Department of Health with some experts, meron time na everyday nasa radio and all, di ba? Tapos, yung learnings nilang yun, ipasa nila sa mga teachers, parang, tapos, gagawin ng teacher yan into a lesson plan. Elementary, high school, college, ipapasa din sa HR department nyo. And then the HR department can create an infographic. Ito ang memo. At ito ang natutunan natin from the experts. So, you have an empowered, educated, engaged workplace colleagues, pati customers. So, gagawa kayong signages pagka, hindi pala ito tama. So, everybody matututo. Yan ang secret niyan eh.
Okay. Still on markets, from anonymous attendee. Thank you, Doc, for that very informative and inspiring presentation. Would like to know when the less than 12 years old population will be approved for vaccination.
Well, mabagal tayo. Dapat ina-apply kaagad natin yan kasi sa states na-approve na ang 5 to 11. So dapat mabilis tayo. So we just get the regulatory documents. Ang Pfizer ang meron yan. And then, para maka-order na tayo ng maraming bakuna. Para, alam mo, ang problem ngayon, baka the rest of the world po nag-Omicron, di tayo maka-order kagad. But we have a special need right now for the 5 to 11 because our kids ang tagal na hindi pumapasok. But the only bakuna na approved for 5 to 11 ay Pfizer. So we have to order. But Eric Domingo, our undersecretary ng FDA, should talk with Pfizer, and Pfizer should talk with the counterpart in the US. Can we get the regulatory documents from FDA approval? So pag approved, makaka-order na tayo ngayon ng more Pfizer. And then may full approval na sa states eh. So dapat i-grant na yan so that the pharmacies, Mercury or whatever, Watson or lahat doon na kasi may cold chain facilities naman eh. So kung ako si mother, ba't pa ako pipila sa may pera naman ako, mura naman ito. Ba't pa ako pipila sa government institution? Bottleneck ang mahawa mga anak ko. So I can go to a Mercury, I can go to a Watson,
Right.
I can go to the workplace, doon ako magpapabakuna as part of the dependent. Kung gusto nyo, salary deduction pa. So everybody will be protected.
But that's a very corporate approach. What keeps the government from approaching it that way? What is the impediment? Pride?
The impediment is the lack of talent inside.
All right.
Hindi kasi 'di ba pagka may kulang ka sa corporation at kailangan mo, sasabihin mo sa headhunter, I want this specific person. All right. Ito yung profile niya. So the headhunter hahanapin 'yun.
Right.
Right. Ilalagay mo 'yun sa team mo. Okay. So, ganun din tayo. Since merong gap sila in that particular talent, then you have to get that talent for the country. Ano ba naman yun? Ngayon, you need divergence of opinion eh. Hindi pa pwedeng ikaw lang ang nagsasabi nito. And then sasabihin, boss, ang galing ng ginawa mo. Oh, pero we don't look at the outside world that there are better ideas than inside.
Well, that's a heavy situation. If you're a corporation, you should just take the person the weakest link, diba? But in this case,
hindi kasi in the corporation kasi pag may kulang tayong talent, we call the HR. We want a person like that. Hindi natin kamag-anak and all. Ang hihingin mo lang curriculum vitae lang niya. And then papa-interview mo muna and then after that, we want that particular talent. So tayo wala tayong professional yung approach natin. Hindi based yan, kilala ko yan, tanggapin natin ganyan. Hindi ganun eh.
Should the military generals run the IATF and not doctors?
Ang answer ko dyan is the HR mantra. Right man for the right job.
All right. And that ends that particular topic. Okay, let's go back to another question. Okay. I saw a question here from JC Principe. Are we ready if and when there is a surge of Omicron infection? Just checking if government has that crisis management in place.
We are ready if we will vaccinate at least 70% of the population. Kaya dapat i-fast track nila within December and January. Once dumating si Omicron and we're 70% vaccinated, we're good. We can roll with the punches, I tell you. So yan dapat ngayon.
And not many places. That's at least the big cities, only Manila and NCRs at that level. Everybody else is not, no? Okay.
That's correct.
Micro, back again to things within our control. Okay. UV lights.
No. Kahapon lang declare lang. It may actually damage your eyes.
Okay.
It's in the front page of the Philippine Star. Pinapatanggal na yun. Ito. Let me read this for you guys. No? Okay, for the protection of the students, the Department of Health has advised schools joining the pilot run of the limited face-to-face classes against the use of plastic barriers and the ultraviolet or UV lights, which can do more harm than good. We have noted that some of the schools have used these UV lights and this kind of filter, so we advise them, especially that it can cause and harm your children. So I talked with my Opta friends, it may damage your eyesight. So wag na po. It's in the news yesterday. You just try to research on it po.
Okay, so out there, because I remember we signed off on permits for UV lights to be brought in the evening and it's turned on and it's supposed to be for disinfection. So it's
Opo.
not really an effective way of killing. Okay. Next question. Okay, Edna Ontiveros, please retype your questions. I'm looking here. It's not it didn't come through. Okay, another controversial question. Ivermectin.
I'm a law-abiding citizen. So if you Google ivermectin, it's not
Yes.
approved in the US and it's not recommended by the WHO. It's not recommended by local DOH. It's not recommended by local FDA. Nandito lang siya sa atin sa Pilipinas, off-label indication. Ang ibig sabihin po nun, siya po ay ginagamit sa animal indications, panghayop po. So meron silang indication for this, pero wala siyang indications for COVID. Ang ibig po sabihin nun, dahil nasa merkado siya, ngayon ang doktor nagkakaroon ng latitude based sa kanyang paniniwala o pang-COVID ka kasi available. Pero hindi siya indicated for that. Let me give you another example. Alam niyo yung minoxidil, which is a drug for baldness, male pattern baldness. Na-discover yan for hypertension. Pero nung umiinom ang mga tao, lumalago ang buhok nila. Nung lumalago ang buhok, inabandon na yung treatment for hypertension. Ginamit siya for baldness. That is an indication outside of the therapeutic effect. So, maraming ganong klase. So, gagamit lang tayo ng gamot kung talagang indicated at approved ng FDA, US, and local. Wala po. I-google nyo kung ang ivermectin ginagamit for that. Kasi ang problema ko, I use that at nakita ng pasyente nagka-side effect siya. Tapos hindi approved. Then, your license might be stripped off kasi you prescribe something that could potentially can harm an individual tapos wala pala siyang regulatory approval. Delikado yun. Ngayon, kung sabihin ng FDA, approve siya for COVID, di gagamitin natin. Pero at this point in time, again, I am a man of rules. At saka ako'y guidelines. Kung walang approval sa FDA, hindi ko po yan gagamitin po.
Paano yan? Isang congressman dyan sa inyo, sa Quezon City. Pinamimigay.
Well, it's something that is politics. Tapos it's something na he believes in. But you know, people can believe something and kung kulang ang kanyang level of understanding, that may be a problem. Kaya nga sabi ko sa inyo, there are three reasons why we fail in health and in life. The first one is ignorance. Kaya dapat we continue to educate people. Number two is ineptitude. Knowledge is there but we fail to apply it correctly. At ang panghuli, o pasaway ka. Ang panghuli, wala kang blueprint for change. So kailangan meron tayong ganong klaseng mindset.
Okay, I have micro questions again. PCR, all the tests. I've done PCR. What about antigen and saliva? Sometimes before you go to a wedding, mag-antigen test muna kayo. So they always say PCR daw is the gold standard. What is your position on that?
It's a gold standard. Kaya lang ang tagal mo siyang makuha yung results. Samantalang ang rapid antigen test, dito lang sa NASO, in 15 minutes parang pregnancy test.
Right.
Lalo na kung the acute onset, malalaman mo kagad, then makaka-isolate. It's very useful. Ang RT-PCR, how much is that? 4,000 bucks.
Yes.
Samantalang ang rapid antigen, you can get it for 1,000 at pwede mong gawin kagad. So that's why sa Harvard, yun ang ginagamit. Then you Google Singapore. Singapore, nasa vending machine pa nila yan at nag-distribute ang government, si Prime Minister Lee. So that you are self-administered.
Right. Pwede yan.
And DIY, do it yourself thing. At meron doon. So nalalaman mo. So kunyari, meron ka ubo sipot. O gawin mo. Uy, positive ako. Call in ako. Hindi ako makapasok because I have this. O. Kung negative ka, o di pasok ka, that's the way to do it.
Because I've seen that's how some of the mga function halls and the ballrooms are starting to open up. Even some tourist destination for those theme weddings. They will have you take, I've heard of friends who are nagpapa-antigen muna sa bago mag-attend ng wedding or birthday party or nag-post sa Facebook or sa IG, we had antigen before. Sabi, papakita sa ng picture. So, antigen, okay.
That's okay.
All right. Saliva.
Saliva hindi masyadong nagagamit, no? Ako private practice kasi marami kang false negative, false positive kasi paano kung hindi ka nakapag-toothbrush for going there? So hindi siya anytime. Ibig sabihin, di ba, marami kang food particles that can actually interfere with the results. Samantalang the rapid antigen test, katulad ng other day, yung aking anak pupunta sa kasal sa Clark. Yung anak ko isa doktor. Pareho silang doktor. But ang kailangan to attend the wedding, the rapid antigen. When we were at, nasa parking lot kami ng Mega Mall, so, ginawa nung anak ko, ayan, negative ka na, o padala mo na para maka-attend ka bukas ng wedding. But ang problema mo doon sa saliva, hindi ka nakapag-toothbrush. Ibig sabihin, hindi siya doable kagad. That's why you pattern that after the best countries in the world. Pwede mo gamitin. Why not? Pero ang benchmark ko sa Asia is Singapore. Kasi advanced siya. Singapore is nice. I like Israel. So humahanap ako ng mga benchmark or best practice countries.
Okay. Because the Red Cross is pushing saliva, if I'm not mistaken. Diba?
Okay naman sa saliva. Kaya lang, for some reason, it may not be convenient for some patients. And number two, in terms of doability, mas maayos sa rapid antigen test over the saliva. Sa tingin ko lang, personal opinion ko lang po yun.
Sure. Okay, Edna came back. Hi, Doc. Do you recommend double mask, Air Queen mask, over a regular mask, especially when you are in clinics or hospitals? Regular mask in workplace or office. So the configuration of your mask, what should it be?
Well, I wear double mask kung kailangan. Lalo na kung nasa hospital setting ako. Well, na open spaces, I usually single mask lang. But in the CDC, inaalaw na po nila ang double masking po. So you look at the CDC, inaalaw po. So use double face mask po.
Okay. Doc, tell us now what you observe in the malls. Because I know you're a mall rat. And I've asked you some of the questions already. What are the things you observe in the mall? And we have retailers and mall developers who are listening to us today or joining us today.
Alam niyo, nakita ko sa mall na very effective kung strict yung guard in terms of registration and all. Kaya hindi nahanap yung contact tracer yung South Africa kasi hindi siya nag-input ng right information. Matagal nga lang siya ng konti, but yun ang way for us to be, I would say, successful. Kailangan meron kang strict implementer doon sa pagpasok. Kasi isa lang makapasok dyan na hindi. Tapos papakita yung vaccination card doon sa security guard. O di, okay na. Then, lagay mo ngayon yung para sa QR code mo contact tracing. Then, makakapunta ka na. Yan ang una ko nakita. Matagal nga lang yung proseso. But talagang ganun eh. Yun ang rules of the game eh. Diba? Number two, nakita ko yung social distancing na maintain. Yan. I like that. Number three, na merong mga marker kung saan ka. Yan. I like that also. Ang ibig sabihin, sumusunod ang mga businessmen kasi alam nila if they violate the rules, sila rin ang kawawa. And that's good. So, once na na-implement natin yan, okay. Kaya ako, I went the other day sa Mega Mall, I went to Vertis, I went to Trinoma, pero siyempre limited lang kasi mahirap din ma-expose ka. I went to Rockwell the other day, bumili akong libro. Kasi kasi dun yung paayos ko ng mata, yung salamin ko, I brought all my glasses, tagal na. And then habang naghihintay ako, maayos eh. Ibig sabihin, we're fine kasi we follow the rules. We follow the rules. As long as we follow the rules, we are in good shape. Sana ma-maintain natin that kind of discipline. Ngayon, kung magiging tayong cavalier and hindi tayo truthful, tinan nyo ito yung bundle of contradiction. Pagpapasok ko sa mall, ang inaalaw natin may immunization card.
Correct.
Pero papapasukin natin ang mga bata na walang vaccination.
Okay.
Di ba? It's a violation of the rules. Kaya sabi ko, magkakasakit talaga ang mga bata kasi hindi sila vaccinated eh. The only time na pwede sila, kung ma-fast track ang vaccination ng kids, then you can actually allow them to go to the school and the malls kasi bakunado na sila eh. Kaya nagkaroon ng controversy dati nung pinapapasok na sa mall ang mga bata. Eh ang rule mo eh, pagpapasok ko, you present the immunization card eh, tama ba?
Correct.
And yet, papapasukin natin ng mga bata, kahit pa may face mask, walang vaccination card. So we are actually flirting with danger and fire. Tama ba yon? Kasi we break the rules eh. Kaya yung last statement ko, we can either break or follow the rules. Make your choice. Kaya sabi ko, knowledgeable, sabi ni Albus Dumbledore kay Harry Potter. O matalino ka na ha? Pero kahit matalino ka at mali ang choices mo in using your talent, magkakamali ka pa rin. It's our choices.
Okay. So yung children in the mall, because we see a lot of them here now. Okay. That's really a big question mark. That's what
Kasi ang problema ko nun, pag nagkasakit yun, madadala nila yung sakit sa bahay.
okay.
Kaya kung gusto ng government na yung retail industry at business ay maging okay, eh di prioritize silang bakunahan ng mga bata. Priority sila kasi tagal na nila hindi pumapasok eh. Then umorder sila naman ng maraming Pfizer bakuna para makapasok ng mga bata. Hindi lang sila makakapasok sa eskwela, makakapunta pa rin sila sa mall. But as long as we don't create solution for that, we'll try to flirt with danger. Eventually, magkakaroon tayo ng surge. If we don't want that to happen, sayang.
Correct. Okay. Doc Tony, ventilation. The malls are enclosed. So what do we have to do? We have to renovate. I mean, that's a lot of capex. What are the quick solutions my colleagues and I and my fellow mall developers can do?
Ang kailangan niya yan is to partner with the Philippine Architect Association and Engineering. Ako nag-lecture ako niyan doon sa mga, ang kasama ko pa nga dyan eh, si Palafox eh, si Architect Palafox. So nag-lecture kami, ganyan-ganyan. All you need to do is sit down with them on how to improve that. Kasi that it will be the future eh. Ang na-imagine ko sa Pilipinas eh para magiging parang Europe na magkakape ka sa labas. Tapos meron ka lang mga design and all. So ibig sabihin, meron kang enclosed, ayusin yung architecture without so much gastos, ventilation and all. And then, expand nyo yan na maging open siya. Di ba when we go to Europe, kahit ka magkape ng 4 na oras, nasa labas ka lang with the sunshine. I think it's about time that the open spaces ayusin na natin. So that pati Changi, pati yung mga, pagpunta ka ng Korea, yung mga pagkain. Ang pinakamaganda example, Singapore. When you go to the Singapore, doon sa river nila, ang daming business. Ha?
The Clark Quay, that river strip. Yeah.
Exactly. So dapat ganun ang thinking process natin. So pagka ganun ang thinking process natin, kasi the virus hindi pa na mawawala. Tsaka eventually maganda yan eh. So we reconstruct our malls in a way sa loob, okay na. But pag nakaano tayo, ayusin natin yung gilid-gilid. So that, tinan mo, mas malaki pa ang kikitain. Kasi ako, I can have coffee all day in the open spaces, di ba? O di mas marami pa ma-order yun, di ba? Ganun dapat ang thinking process natin.
But that's opening up the bulb. How about yung we're gonna set up in the atrium, we're setting up in the corridors, in the hallways, okay ba yun? Or do we have to put other equipment so that we can, ventilate?
Hindi equipment eh. Nakita ko napuntahan ko sa Mega Mall. Yung, ano ba yung kinain namin na pound. That's the burger.
Yes. They have a kubo.
Yun, kubo. Tinanggal nila from the restaurant, nagkubo sila ngayon. O di, okay. Tapos naging innovative sila sa pagkain. Kasi ang hirap kumain ng malaking burger. Ang tagal eh. Eh ngayon, kunyari may malaking burger. O di, ang bilis. Pareho rin ang concept eh. Bite size and all. Enjoy mo. Eh kasi kung kakain kang buong burger, tagal. Samantalang kunyari, kung kumain ka ng burger na ganyan, tsara mo kaagad yan. Yeah, nakikipagkwentuhan ka pa rin. What I'm saying is the concept, yung F&B should try doing some food na mabilis kainin na masarap pa rin. You know what I'm saying? You
Yes.
guys,
Right.
you need to be creative.
You kind of streamline your menu and change the look of the food, but it's easier and faster to consume. Diba? Okay. Now, I have last 3 questions, 1 macro and 2 micro. Vaccine preference. Bakit may mga choosy pa?
Kasi, aminin na natin to. Pag pumunta ka na mall and you have enough money, where will you go? Siyempre, gusto mo rin bumili ng Lapos. Gusto mong bumili ng Fred Perry kung may pera ka. Di ba? Tama ba ako?
Okay.
If you had the choice, siyempre, pipiliin mo mga Western vaccines kasi yun ang nababasa mo. And every Filipino, may relative sa Amerika. May pinsan, may ganito. Ito ginagamit namin dito. Ang problema, hindi sila nag-customer survey bago nila in-order mga bakuna. Nagdapat gawin. What vaccines ang gusto ng Filipino nation? Di kunyari top on the list, di na o-orderin mo. Ngayon, ang dami mong inventaryo ng gamot, ng bakuna na hindi gusto. Paano mo isasalya yan? Ang expiry dates nun, ang konti-konti. So, kunyari ako si Bibian, should I order medicines na hindi gusto ng customer ko? Ang tataas lang ang inventaryo ni Bibian doon. Tama ba? That's why in the corporate world, again, going back to the corporate world, nagba-market survey tayo. Bakit naman ka o-order ng gamot na hindi ko to? Kunyari, Ponsan SF, I remember that, kaya nag-super fast. Anong attribute ng painkiller kaya gusto mo? Ang una, effective at saka fast relief. Di na uso yung super fast. So you have to put that in the context. Ngayon, sa survey, anong lumabas? Kaya ayaw nila kaya mataas ang vaccine hesitancy. 60% said safety. And the next naman is efficacy. So, some of the vaccines will not meet this criteria. Why should I buy that? And people are reading. Kaya ang taas ng vaccine hesitancy. So dapat we should veer away from products na hindi gusto ng Filipino citizen or else mapapanish yan. Ngayon, kung nabili na yan, then you have to have a marketing position. Ini-niche mo siya. Saan siya pwede? Yung malakas ang immunity, let's say yung ganito, workplace, pero with the promise that you will be given a nice vaccine in the future.
And that should be the strategy for getting rid of the Sinovac inventory.
Yes, ini-niche mo siya, di ba? You know what I'm saying, guys? You understand what I'm saying?
Yes.
Ini-niche mo siya kung saan siya ang market. Ang market niyan, when it was first approved by the FDA, for less than 60 years old. So, ibig sabihin, 18 to 59 na magaganda ang kanilang katawan. Di isalya mo siya sa mga workers, nakadalawa sila, and then promise a booster later on para maubos mo siya. Pangalawa, it should go to the Bisbee area na may social distancing and all, na hindi mo kailangan ng cold chain facility. Kaya in other areas, nasunog yung sa Pfizer kasi kung walang electricity, mag-overload yung electricity mo. Kaya ang daming nasusunog. Kasi in the area, maraming wala doon generator and all. You need freezer vans, you need cold chain facility for sub-zero temperature. So dapat yung mga bakuna like say Astra, pwedeng gamitin yan in the countryside. Sinovac, pwedeng gamitin yan. Janssen, pwedeng gamitin yan. Pero Pfizer Moderna, highly urbanized area na meron kang cold chain facilities. Let's say Cebu, Cagayan de Oro, Davao, NCR, na may freezer vans ka na pwede mong gamitin. Yan ang ginawa sa UK eh. Kaya para hindi maaksaya, every product magagamit natin. And then, after na maubos mo siya, makonsume mo siya, order kung ano ang gusto ng Filipino citizen.
Then you calibrate.
Calibrate.
Okay. Still on vaccine. I think Vivian raised this earlier before we started. Yung 6 months, does it have to exactly be 6 months? What if my appointment came in 2 days before or 3 days after? Am I vulnerable?
Pagka a few days lang, it doesn't matter. Kahit 1 month, okay lang siya.
Okay.
Oo. And then
1 month
ngayon,
before, 1 month after.
kaya ngayon pinapacheck ng DOH o Pfizer yung stability. Alam ni Vivian yun, stability. Baka pwede pang 3 months leeway, no? So pag sinabi ng quality control ng kumpanya ng Pfizer, okay siya, then gamitin ka agad. Wag niyo itatapon niya sa Mindanao. Ang layo-layo. Dapat gamitin ka agad ng malapit within the NCR area kung saan area na pwede natin i-deploy.
Okay, last question. I noticed there are ads for trip to El Nido, Boris reopening, people are taking out-of-town trips. What are your tips for our friends who are going to take these out-of-town trips? And I have 1 or 2 people I know are going out of the country this Christmas.
Ako, I traveled already to Pico de Oro.
Okay.
Okay, twice na, last March, and then nung nag-lecture ako sa Philippine Hotel Owners Association, then 2 weeks ago, I went to Pico de Oro. Kasi open, di ba? So, what I'm trying to say, ang unang gagawin is to protect yourself. Have yourself vaccinated. And then a booster. Then you're safe to travel. Yun ang una. Number 2, you go to a place sa tingin nyo ang ventilation okay. Number 2 yan. And then number 3, sa lahat, go to a place na I would say safe naman na hindi masyadong maraming tao. Lahat tayo magko-congest tayo sa area yun. Kaya sa Baguio, I just talked to Mayor Magalong. No?
Yes.
Kasi kaibigan ko siya. Nililimit lang pala nila sa 2,000 tourists lang muna kasi ma-overload. So, biro mo yun, there's an LGU head na nagsasabi. They follow the rules. Ang ibig sabihin, follow the rules. So, pagka nakita nilang LGU, they following the rules, they make their LGU and their environment conducive. Tapos ang population bakunado na. We can go to places na gusto natin. Boracay. My daughter went to Boracay. Maayos. Meron destination wedding, pinuntahan ng anak ko the other day. Maayos. Because they're following the rules. Ang importante sa atin, we should follow the rules. We should make the environment receptive. But we need to protect ourselves by vaccination and trying to booster also ourselves.
Okay, that was my last question. Any final advice to our retailers, to our mall operators, and to our friends in the industry?
Well, guys, alam mo, this is the best in the worst of times. The worst of time because we have a pandemic. And lahat naman ng sa buong mundo ay talagang ganyan di ba? But we are also in the best of times. Unang-una, why? Because we have the resilience of the Filipino people. Yan ang una dyan Number 2, we have the antiviral drug, molnupiravir, nandiyan na. Pfizer will come up with the Paxlovid as well. Then we have vaccines right now in place. Number 4, is a way of life already na marunong na tayo sa drill. So what I'm saying right now, it's for all of us to sustain this kind of situation. And if we will do that by following the rules and making ourselves healthy, exercise kayo, diet, ang natural immunity is also good to complement the vaccines that we're having. Kaya nag-present ako doon, something to improve your immunity. Kasi hindi ka nga mamatay sa COVID, namatay ka naman sa heart attack. Hindi pareho din yun. So kailangan pareho, non-infectious and infectious, healthy tayo pareho. Pangalawa, ang nadadali rin ng COVID ay yung mga pasyente may cardiovascular disorder. So lastly, health is wealth. An ounce of prevention is better than a pound of cure. And nation's health is nation's wealth. So if we do this, we will have a merrier and a safer Christmas season.
Thank you so much, Dr. Leachon. Thank you so much. It's a wonderful afternoon to be with you. And I hope everybody had insights. Madami kayong napulot na mga gamit natin. Gusto natin ituloy ang Pasko. Correct, Dr. Tony?
Yes.
All right.
Then I'm willing to share my slides sa inyong lahat.
Oh,
so that,
nice.
So that you can cascade it to your colleagues and everybody. Para sa ganun, you can use that as a template in terms of informing your workplace colleagues, friends, and families. Kailangan natin din. Let's share the information.
Are you on socials? You have IG? I know you have IG.
I
Where
am
can
on
they reach you? Just in case they want to ask a question.
Meron akong Facebook public page, meron akong Instagram, at meron din akong Twitter po. So, ganun lang po.
Okay.
And my email is anthony.leachon@gmail.com, just in case you need to contact me. Or if you want my cell phone number, you can get it from the PRA.
Okay. Yes, Minda. Doc Tony will share the slides. Okay. That's Minda Carpio, one of the legends of Philippine mall industry. All right, ladies and gentlemen, thank you so much. So wonderful afternoon with Dr. Tony Leachon. Ivan, where's our token of appreciation for our good doctor here? Thanks, Dr. Tony. That's what I like, the self-care portion. All right, Dr. Tony, virtual muna ang certificate of appreciation for sharing your invaluable time and expertise as speaker to the 49th PRA Virtual Learning Series on how to end the pandemic through a resilient and empowered retail industry. Held on December 9 via Zoom, Dr. Tony Leachon, independent health reform advocate, past president, Philippine College of Physicians, and chairman, KILCOVID, and a truth teller. Signed by Rosemary Ong, our president of the Philippine Retailers Association, and Evelyn Balmeo Salire, our secretary general of the Philippine Retailers Association. Thank you so much, everyone. And please, this is our digital learning series. I congratulate the Philippine Retailers Association's team for being able to continue learning despite the pandemic. We have a QR code that we have to, if you want to give your feedback on how we handle today's learning session. There's a QR code, Ivan. Take a few seconds for this. Okay, please, we want your feedback so we can be of better service to you as we face the challenges of 2022. Okay, that's it, ladies and gentlemen. Now, coming up on December 12, yes, 12/12, like a Lazada and Shopee launch, is the Let's Talk Retail two-part year-ender episode. 2 parts, all right. And she's our guest, Margot Torres, the Managing Director of McDonald's Philippines. Please join us. It was a wonderful conversation I had with her. That's why it became 2 parts. Lots of insights on her journey to be the head of McDonald's, okay? Women power, okay? Coping with the pandemic, how McDonald's pivoted to cope with the pandemic. So please subscribe to our PRA on the web. That's on YouTube, all right? And just subscribe so you can, on December 12th, the first episode will come out. While you're doing your Lazada and Shopee and Zalora shopping on 12/12, press the button for our PRA Let's Talk Retail podcast, all right? So on that note, we conclude our webinar for today. This is CJ Hesena of the Shangri-La Plaza Corporation, wishing you a pleasant afternoon and have a good weekend ahead. Thank you.